Okay, so it's 5 o'clock. We can begin the meeting of the Board of Health on March 22nd. It's 5 p.m. I think everybody's in attendance. Is all the board members are in attendance? Is Tim's there? Mark and Kristen. And in keeping with the ongoing emergency order from Governor Charlie Baker to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by board members will be remote, and remote attendance shall count towards quorum. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda or copy it and paste it into your browser. To join a remote meeting using your phone, call the number provided underneath the URL. You will be needing the meeting ID to join by phone only. And if you are going to make a comment, please give us your name and address. Okay, so today we're going to talk about an update on the novel coronavirus. Kristen?
So good evening. Since the last time we spoke, this is the slide I've been opening up with for quite a little while now, and just kind of gives us a little bit of history as to where we've been and where we are today. And you can see, oh, there we go. As of today, actually using the data for the window that the state uses for reporting, which actually would only take us through last Wednesday. The town had 1,812 confirmed cases of COVID since March 12th of last year. Easton's average daily incident rate is currently at 20.8 per 100,000, which puts us right in the yellow. But it is important to note that we're slowly ticking away and coming down. We're down from 28.9 last time I reported this to you. We do continue to see spreads pretty much predictably, households, daycares, and indoor activities, where people are indoors, are not wearing their masks, and are not being as diligent as they would be when they are in other situations. I'm trying to, I have to keep moving you guys so I can see what I even have in here. I've left this star up on the graphic. That was the week that the state decided to, the governor decided to step us back into step 3, phase 1. And as you can see, that is, we did peak shortly thereafter, and we have steadily declined in our percent positivity and in our case counts since those precautions were taken. And since now we actually have been adding more things, it's encouraging to see that the numbers continue to go down while some of the things that we're able to do have actually increased. I have this window that I can't get rid of. And I have to keep moving all of you or I can't read. Sorry, I am having technical difficulties.
Kristen, can you change the view that you don't look at us?
No, I don't. I just have you guys off on the side. It's just, we'll work through it. No matter where, I either have to move you from the top to the bottom or because you're in the little film strip mode. But actually, if I cut you down to 1, there we go. Now I can't see any of you. So we actually, as of today, moved into phase 4. This will actually open a range of previously closed businesses and sectors under tight capacity restrictions that we do expect will get adjusted over time. And they include such things as large sports and entertainment venues that will be permitted to operate at a strict 12% capacity limit after they submit a plan to the Department of Public Health. This is the one area where they have not left it to locals to review or hash out any plans or precautions that need to be filed or dealt with. The state is actually taking these on themselves. So this would be most of our indoor and outdoor stadiums, large arenas, large ballparks. I think when we all think about the outdoor venues, the stadiums and the ballparks, we all have days like today, and we are very encouraged and very thankful to be able to be in a place where, at 12%, it permits us to actually spread out and still enjoy some of these long missed activities. So effective today, also the gathering limits for event venues have increased. So now venues are able to have 100 people indoors and 150 people outdoors. Outdoor gatherings at private residence, though, will remain at the maximum of 25 people, with indoor house gatherings remaining at 10. Additionally, dance floors are now permitted at weddings and other events. For ed events only. We're not able to just go to the local establishment and dance. It has to be associated with a event venue. Lots of different reasons for that. Contact tracing being among one of them. Bunch of other sectors do continue to remain closed, and a bunch of other events still remain on the horizon, road races, festivals, things like that. Okay, now I can't move us to the next slide. Another change that happened today is the Massachusetts travel order, as of today, is replaced with a travel advisory. The new travel advisory urges all persons entering Massachusetts. It no longer is tied to a color-coded map that gets updated on a weekly basis. It's more general in that anyone returning to Massachusetts, including anyone coming to Massachusetts as well as anyone returning, is advised to quarantine for 10 days upon their arrival if they have been out of the state for more than 24 hours. The advisory does not apply to anyone who is returning, as I just said, after an absence of fewer than 24 hours. It does not apply to travelers who have a negative COVID test result that was administered up to 72 hours prior to their arrival. It does not apply to someone who has completed isolation after testing positive for COVID up to the 90 days after their recovery. So once a person is able to exit isolation, they have 90 days that they are allowed to come or return to Massachusetts without needing to quarantine. A new category and acknowledgement is for travelers who are fully vaccinated. That would be those people that have received 2 doses of the Moderna or Pfizer, or those who have received the single dose of Johnson & Johnson 14 or more days ago, and they do not have symptoms. So if you received a shot 7 days ago, you're not entitled to this exemption. If you received your shot 13 days ago and you have symptoms, you're not able to be exempt from this. You have to kind of check all of the boxes. It has to be at least 14 days. And as with any other, any situation, anyone who has symptoms should be quarantining and trying to ascertain whether or not their symptoms are related to COVID. Travelers are additionally encouraged to consult and follow CDC guidelines and requirements for travel. Right now that involves wearing masks on planes and, still taking all of the precautions that we have been taking for the past year. As much as we all want to be done with them, they are what's gotten us to this point that we are able to move around. Last week also, so the governor did a lot of announcing last week. One of the things the governor announced last week was he added, as of today, some certain sector workers, including grocery store workers, utility workers, sanitation, public works, public health workers, also brought down from 65 to 60. And he also put hard numbers on when the next categories would also be made eligible for testing. That would be on the 5th of April. We will be moving towards individuals age 55 and older, as well as anyone with one of the listed medical conditions on the state's website. And then shortly thereafter, we will move to phase 3, where all individuals over the age of 16, if it's Pfizer, 18, excuse me, depending on the vaccine, um, for Moderna and Johnson & Johnson would be eligible on the 19th of April. Our vaccine efforts, I'm happy to announce that we have just passed 1,000 doses administered, and we have been able to focus on some of our most vulnerable residents. The pictures that you're seeing on the screen tonight show our effort to get around to the housing authority and to actually be able to vaccinate all of the residents who desired to get the vaccine in their own apartments, where they were comfortable, where they felt safe. We didn't have to worry about getting them into a community room or having them traverse any distance. They were first, if you look at the picture on your upper right-hand side, I wish I could have zoomed in more, but it really gives you a sense for the whole team that was necessary to make this work. You'll see that there are a couple of people in yellow vests. Those are the CERT team associated with the fire department, a absolute wonderful core of volunteers who have turned out for so many things that we've needed them for during COVID. We had the fortune as a health department of working with them prior to this on some extreme heat events and some other sheltering events. But they've really been there every time we've needed them for COVID related activities as well. You'll see one of the employees of the Housing Authority in this picture, as well as our own Tim Myers. And you'll see the back of one of our firefighters along with their handy little Kubota that was kind of the traveling base for this vaccine effort. We were also able to last week get out and do some homebound individuals that were not associated with the Housing Authority. And you can see that there is one of our Easton firefighters with the ambulance that actually went to a bunch of different residences last week and administered vaccine to people in their homes that were not able to get out. We're shifting, we're moving ahead, we're constantly adapting to what is in front of us. We do, as an emergency management association, the executive team does continue to meet twice a week. We continue to plan for upcoming challenges and upcoming steps as we all move towards the new normal and as things begin to open with greater accessibility. The schools and Board of Health staff continue to have daily check-ins. Tim is up and working in Maven. The COVID website continues to be updated. We've removed a lot of older information, a lot of information about our local vaccine efforts, since we no longer will be receiving vaccine from the state. We are working to help identify homebound individuals for future vaccine efforts. But we will be working to hand those off to the statewide program, again, with the absence of any predictable supply. We felt the most prudent thing to do was to participate in the state program. And I believe that the website on that may be going live as we're speaking right now, because I received an email this morning asking to confirm some information. That will end up having a toll-free number that we'll be able to refer residents to get in the queue. And the state has contracted, I believe, with a private ambulance company. So I think similar to what anyone might have seen or heard about us doing at private residences, where an ambulance would show up, complete the screening, do the vaccine, and do the monitoring. So we're looking forward to seeing what that really looks like. Hopefully it's up on the website tonight. They had promised that it was going to roll out this week. So fingers crossed, we'll be able to help get more people who are unable to get out of their homes vaccinated as well. That is all I have for tonight. Does anybody have any questions or comments?
I have a couple.
Okay.
And this is just questions that have been asked of me that I cannot answer, specifically related to school stuff. So, if you can't weigh in, that's fine. One of them, is it true the schools only accept one COVID test? And
So
why is that?
the school policy is to use the PCR, which the state is also the state allows one rapid, which is the Binex Now,
Yeah.
which is not readily available.
Mm-hmm.
But it is the PCR test, which is the gold standard.
Right. Okay. So they're not accepting that other one.
They don't accept rapid
Okay.
antigen tests, other than if somebody were able to get the Binex Now. I don't know if they've actually included the Binex Now in their list.
Okay. And again, I apologize if you're not that involved with the schools or the decisions that they're making. They make references to Board of Health, but I understand there's a differentiation between Health and Human Services and Board of Health. There's a concern that people don't know why, or even if, is the school committee superseding the states as far as requirements going. So we've checked with towns around us and they have, XYZ requirements. It seems like the school committee has gone above and beyond, which is frustrating to some parents. And they've posed that question to us as the Board of Health. And unfortunately, and it's no one's fault, should there be another pandemic, things like this happening, I think like even bi-monthly meetings of us with the school committee talking about some things, because ultimately we seem to be the ones that are getting blamed. And I can't answer every question. I can only, ask this of you. And unfortunately you have to do it publicly, which we all understand, and it's not an attack, but it seems I don't find anybody on the school committee whatsoever an expert on COVID. And they seem to be making rules above and beyond the state. While I'm grateful and thankful that it's for the safety of my children or the town's children, there's a breakdown somewhere. And so I'm asking on behalf of the people that have asked me, but also as a resident, why that is.
So the school committee, much like the Board of Health, is an elected board that is charged with a certain mission. The school committee at their last meeting on the 11th spent quite a bit of time discussing this particular issue.
Yeah.
And much like the Board of Health has the ability to make rules, regulations, and policies that are stricter than state based on what are our immediate concerns in our community or that fall under the Board of Health purview. Perfect example, when this began, we had a concern that it was not productive to be chasing businesses down for their COVID plans only when we got a violation. So we put something in place that was stricter. We require that they submit their plans without having to. And it caused some confusion. Businesses said, the state website says, I don't have to file with you. And we were out there in the position explaining that the Board of Health felt that it was most efficient and most productive for us as a community if we had those plans in advance and we had the conversation ahead of time. So just kind of a similar type of thought process. The school committee did ask I shouldn't say the school committee, the superintendent did ask me what I thought about the travel restrictions that were in place. And this was prior to the governor making this travel policy change. And I said, as a professional, don't really find a lot of reason not to come into alignment with what the state is saying.
Yeah. Sure.
I was asked that in different venues and different school committee and by others. I feel like we've gotten to a point where people are cautious, people are very aware of what they're doing. And I personally don't think that there is in general, a reason to have, for adults, a policy stricter than what the governor had revealed prior to this. This was
Yeah,
before this,
totally get it.
this
Yep.
new lightning even of what we're doing. The school committee did spend a good amount of time. I just actually finished watching the 4-hour school committee, or listening to the 4-hour school committee meeting. And they had concerns about their specific environment. And they're charged with protecting their specific environment. And they felt that now was not the time, I'm paraphrasing, but that they were not comfortable loosening the travel restrictions, which are in there. They require, and basically what it comes down to is they ask people, are requiring people to wait till they have been home for 5 days before they get a test.
Right.
And if you follow the incubation period, and if you follow, there is some logic to it. They, as a board, as a committee of 5, debated it, discussed it, and made a decision. That's their prerogative to make
Oh, absolutely. And
policy for their specific environment. And of course, that obviously they can't make any policy that is less than the state requirement.
oh, totally get it. I guess my concern is, so I have the benefit of being on the Board of Health and being a paramedic, being certified to give a COVID inoculation, to give a COVID test. I have treated and transported dozens of people with COVID. I'm very comfortable and knowledgeable about it. Lynn has dealt with similar the same. You guys are all COVID trained. I mean, if it doesn't have to do with septic, this is what everyone's been dealing with for the most part for the past year. I don't find one person on the school committee at that level whatsoever. So it's concerning to me that, and I'm not bashing the school committee, but they're enacting policies that, well, making my phone ring off the hook. and so I'm just trying to pass that message on. But I mean, would it make sense for all of us to meet? I mean, they're a very highly intelligent group. I'm not taking that away from them. And I know very little about what goes on into educating children. What I do know of is what goes into protecting children medically. And it's concerning to me that I frankly don't agree with them. And I know this is not the forum for that, and I could weigh in at one of their meetings, but there's, aside from you, who consults with Dr. Cabral, and I believe you at your every word, I don't, there's not a lot of public, I'm just not getting the warm and fuzzy that, I'm not saying they don't know what they're talking about, but there's nothing to back up the school committee science. Whereas everything on our end, we're basing it on documented fact, experience, and science. Do you know what I mean? And I guess there's got to be some way to bridge that gap, because it just seems to me, and this is based on, I've watched the meetings as well. I'm a parent, and it just seems to me that moving forward, I'm not comfortable with people making rules that are just not qualified to be making those rules. I mean, erring on the side of caution is great. And as a town employee, the town of Easton has been exemplary, above and beyond, hands down, one of the best towns around for COVID as far as protecting its employees. I mean, sending people home without a reasonable doubt on administrative time and everything like that. It's this one little missing link in this chain. And I will take responsibility from a Board of Health, and that for a year there's not been awesome communication between the two, and that's okay. They're two separate boards, and people really haven't given that any thought. But this last school committee meeting, when I see them making these rules, and I think we're going to go above and beyond the state and everything like that, well, to me, none of that is, now it's starting to not make sense. And I think we can do better, and I think the people of this town deserve better. And I don't know how to go about fixing that. So I'm asking you, and it's not me being mad or anything like that. It's just they're going above and beyond with their testing rules, this, that, the other thing. we're coming up onto April vacation in a few weeks. It's a time when, you know, the state encourages you to go on vacation. That's why it's a school vacation, other than, you know, everyone's brain needs a rest. And people that are going to be out of state and being honest about it, because we all know that there's plenty of people that will probably go out of state that won't be honest about it, are going to come back and being told they can't even log in remotely because you're on vacation. But if you say that you were on a college tour, then, you know, it just, I feel like there needs to be like a Board of Health school powwow or something at this point, because some of the rules are starting to get ridiculous on behalf of COVID. You know, I was curious of your thoughts.
They are the policymaking board for the school committee. The only difference from the state travel, and again, these conversations all happened before the governor changed the travel advisory recently, as of today. The only difference, the state has required the PCR. That wasn't a change. The difference is, the only difference that I see right now is they were uncomfortable walking away from the 5 days when people return. So
based on what science? So they're smarter than the state scientists and doctors, the 5 of the school committee? I mean, and I appreciate the protectiveness of everything. Like, I probably sound like a crazy person, but there's
up until
a
a week ago, Mark, Tim, correct me if I'm wrong, we didn't have a test out option as town employees at all.
We did not.
We did not. If we traveled, our employer had a strict enough policy that we could not avail ourselves of the test out at all. So employers, policymakers, I mean, and this is a constantly evolving situation. That discussion was 2 weeks ago. That was prior to the governor changing the travel policy across the state. It was also prior to, there was discussion in that meeting too, is wanting to wait out just a little bit longer and see if there were any increases in case numbers.
And based on the numbers, it looks like even after post-February vacation, the numbers have still continued to decline.
And again, and I'm not a state level epidemiologist or scientist on that front either, but I think one of the big differences between the Thanksgiving and the Christmas holidays is those were, and I've said this in every meeting, what we see the spread at. People being indoors around tables, dining together and relaxing. I think what we saw with February vacation, and we would hopefully see with April vacation, is that more of the activities are outdoors. There's the fresh air element. There isn't the closed, confined spaces. The school committee is charged with making policies that they feel are in the best interest of the students that they're tasked with overseeing.
So I understand that. And I guess my question is, based on what experience and science are they basing these decisions? Because we're now thinking about, and again, this isn't, I feel like we should be weighing in more as, I'm not gonna say experts, but you guys are certainly experts with some of their decision making. Not that I want you to have to go to more meetings or anything.
No, and
that,
again,
but,
the superintendent asked my opinion, which I rendered. I believe she asked the school nurses their opinion, which they rendered. And she made a recommendation, and the school committee, as the 5 elected members of your community, chose a different path.
Okay, that's not good enough for me, but I will have to accept it for now. And I know, I guess I have to take it up with the school committee, but I think that the Board of Health and the school committee can do better. And in the past year, there has not been any communication with the two, and it just seems like there's more and more, like, we're concerned with the kids and everything like that. And I greatly appreciate them erring on the side of caution. And God forbid something terrible happened, I'm sure there'll be people like, well, you didn't do enough to protect my child. So I get that, but I think now we're at a precipice where I'd rather hear from an expert. I'd rather hear from, you, the state, or whatever. Here's what all the other towns are doing. Why is Easton going to do it different? I mean, as awesome as it is, but I just feel like either there should be some bridge between the two, or a general meeting with the school committee and board of health to discuss some of that. We're both elected committees, but at least with the board of health, we have qualified people that work in this field, that can weigh in.
I think what you're saying is the board has to be part of the conversation more. That would lead to decisions and I don't want to.
You know what, Lynn? Based on the calls that I got today, I think it would instill some of the public's confidence, at the very least, that they would see it. Not that I have time to attend another meeting, but it just, and I don't want to. I'm trying to word this, politely. It's just, people are now concerned, and this is probably not the forum to be voicing this, so I'm saying this very reluctantly, but it just seems that people are now concerned that the school committee, while very appreciative of the fact that they're superseding state requirements, based on what science and what need are they doing that? And now they're not satisfied with that, so they're calling us, or at least me. And I have 4 different questions that I got just over the past 2 days regarding such. So, and as an elected member, I opposed with putting that forward.
I just want to put out there, because I'm not sure that the information is out there. The nurses were asked about the travel order, and we said that we felt that they could get tested on their first day back, just like the teachers. So I just want to put that out there. That was, the nurses felt at this juncture that would be something that would be okay. I feel like, I know what Chris is feeling. I feel like as the Board of Health during a pandemic, as the elected officials, we haven't really been part of any conversations or anything. And I really, when I joined the Board of Health, I thought, if anything big, like something like this came up, I never imagined this. I thought, we would be involved with a lot more and in helping to make some of the decisions. So if I'm not hearing you right, I'm sorry, Chris, but that's what part of my takeaway is.
A good chunk of it, yeah.
I feel like there are meetings, and a lot of things are discussed, and a lot of things we probably wouldn't have to weigh in on, but I feel like that we'll look at our meeting tonight, guys. There's nobody here asking questions, right? Here we are, there's no one here asking questions. And when the school committee meets, parents should be directed to ask the questions there. I know sometimes they do, and it can get a little bit, rough, but I just feel like people come to me too, but they come to me with the wrong questions at the wrong time. And when we're having a meeting like this, where is everybody? You know?
I mean, I'm not trying to be antagonistic by
I know you're not.
I'm just at the point where, okay, at least you're a nurse. I'm a paramedic. I can weigh in.
I know.
And I'm not saying they can't weigh in intelligently, and maybe it just, when a parent asks me, why they're qualified to make these decisions, and I said, just like Kristen, they're the elected board and they're charged with that, just like we're charged with approving a foot less of topsoil on somebody's septic system, as riveting as that is. But it's not good enough when it comes to public health and COVID and everything like that. And the concern, and to your point, where are they right now? No one's weighing in. I unfortunately didn't see the school committee meeting until the next day. I watched it.
No, and I didn't mean it mean
So,
to the public, but I'm feeling like people will email me and text me like they do you, but we have to have it all out there.
Hmm.
I-
I mean, that was my point. I was just trying to,
Can I just ask a question real quick though? So what I'm hearing you both say, I get what you're both saying, but I guess my question would be, so we know that the school committee are not experts on COVID, and we have a firefighter, a paramedic, a nurse, a clinical social worker. We're all in this healthcare field. We all understand it. So maybe we're better poised to have these conversations. But at the same time, we're still not we're not exactly qualified to supersede the state guidelines either. So I'm not sure.
exactly. I agree so, I mean, but I feel like I can speak for myself, and I'm more qualified than them.
Do you know that though?
Yeah, I do.
And again, my recommendation was to come in alignment with the state policy. The school nurses made the same recommendation, and the superintendent put it in front of them as maybe it's time to move into alignment. And I have the school nurses agreeing with me, and I have the
Yeah.
director of the health department.
And I agree with you
Yeah.
too. Like, I agree 100%. Like, so
I don't know what the solution is.
Yeah. No, it's out there.
And now the governor's recommendation has changed again, so perhaps they will be revisiting it. If it does appear on their agenda, I mean, would you want to take a vote that I notify them in writing that the Board of Health is in agreement with coming in? I mean, we could do something along those lines if you wanted to put it in writing. That I said in all the correspondence, I too was receiving emails. I've been receiving emails from parents on a lot of different areas that are not.
It's crazy. It's
the
a
Board
crazy
of Health
time.
purview, but I have, and I was very clear that was my opinion as the Director of Public Health. If you would like to have us prepare a document that echoes your opinion as the elected Board of Health relative to this issue to be delivered to the school committee, we could make that happen.
I mean, I'll defer to everyone else on that.
We would have to probably take a vote and stuff, right?
Oh, absolutely. Or
Are there specifics though that you're requesting amended?
What I think Kristen was saying was we could all collectively say, what we think should be done with the travel order.
Right, that's my question. Are we just speaking in terms of travel orders? Is that?
I would like to see them come in alignment with state protocols like everyone else has. That would make, I think that would satisfy. You can't argue with, if Kristen says, this is what the state says, this is what we're doing. And it's great to go above and beyond when this was like at a peak. A year ago, people, if you walked into, if you were across the street and somebody sneezed, you thought you might die. You know what I mean? And the sciences showed the vaccinations and everything like that. I'm not saying we're all comfortable with it, because I mean, when I go on COVID calls, it's still uncomfortable, but at least I know how to protect myself and what the science is. I would just like to see, and I don't know if we can take a vote on it or what have you, because the schools are separate and they're their own thing, but it would just be nice to see everyone come into a line with all the districts around us and with state protocols. It gets to the point, well, why have state people working on this if we're going to do our own thing anyways? I mean, that's just me.
If in town wants to be more cautious than the state says for a certain situation, is it the Board of Health's purview to say, well, no, you can't be that safe? That's it. You tell me, Kristen, how does that work?
I don't think you could issue any type of order or regulation or anything that could make people do the bare minimum. I mean, in most of the codes we operate with, when we talk about housing and camps and everything else, most of the stuff we get handed by the state are considered minimum standards. You have a elected school committee who right now is not comfortable moving away from having that time period when people get home from a vacation for symptoms to develop and for test results to come back. You know, I
get it. The state feels differently, and somewhere they have the qualifications and expertise to supersede that, and the elected power to do so. I get it, and I don't agree with it, and I know it's not you, and you're trying to, you're in a tough spot, and I'm sorry that I'm asking you these questions, but it's like I would even be willing to like roundtable this with them at a joint meeting or something like that. I just feel like if there's that concern that they're making those type of decisions, and when we just had stats up on the computer saying, well, you know, after February vacation, 2 weeks after February vacations, the numbers are still continuing to decline. Now, you know, being a skier, February vacation to me is an outside holiday, but a lot of people, it's not. Outside week, I'm sorry. Most people are still stuck inside because it's cold. April vacation, to me, would be more of an outside. You know, it's great to see the fields being used and everything like that, and people away. And for the most part, from what I've seen, people are being safe. I kind of take exception with the fact that they're going to.
I do think one of the points I do think I recall that came out is this is also coinciding with they're about to go back in person at 3-foot distancing.
Right.
And again, they are taking a very cautious approach to not make both changes at the same time. It's not, they didn't walk away from the meeting saying they would not reconsider it, that they would not come back to it. You know, these are unprecedented times. A year ago, we thought doorknobs were the problem. And now we know the doorknobs are not the problem. A year ago, we were being told not to wear masks. Now we're being told to double mask because now we know that is one of the most effective ways that we can stop the spread of COVID.
No, like I said, I'm more than willing to help in any way. It just, I'm done. It's very difficult to watch non-medical people make medical decisions. Extremely. And when people come to me with that, and I'm not throwing anyone under the bus by any means, any stretch of the imagination whatsoever, but I'm also a grossly logical person, even though if you ask my wife, sometimes no, but it just, I can't make sense of it. And when someone asks me that, I'm like, you know what? I don't know. So I'm passing it on. I don't even know if we need to take a vote or whatever. I'm sure you'll be consulted again the next week on, you know, I mean, and I'm sure every time something changes, your phone's ringing off the hook, and you have to answer to Dr. Cabral and Connor and everything like that. And like I said, it's been phenomenal. So as an employee, everything, like I'll be the first to say, you know, the town of Easton has done an amazing job. Even with the
clinic. Got an award.
Yeah. even I got text messages the other day. Was it Monday you guys had the clinic? No, last week, I'm sorry. And Chris, so efficient, like people that I haven't talked to in years that were just people that really aren't ones to go say something complimentary. And like usually people you hear from people when they're PO'd, you know what I mean? And these are people going, this is unbelievable, the town. I hope we can get more vaccines and continue to do it. But it some of the decision making, I have to just take a little exception to it. And I know it's not you. I know it's not this board. It would just be good to see some more involvement. I'll volunteer you.
Okay. Did you have other areas, Chris? You said you had a couple of.
I think I encapsulated it all into that rant, so I'm done.
Okay.
Thank you.
It wasn't a rant, and thank you for bringing it all up.
As you said, we have received, and on many different levels, a lot of positive feedback, especially surrounding our vaccine efforts. One of the things that we had undertaken very early on in an attempt to at least make people feel heard and connected and a little bit like we had their back was we opened up and we had what we called a COVID communication list that was people interested in receiving vaccines through the town. We had it broken down by the different priority groups. And last week with some of our remaining vaccine, we finished up calling or trying to contact those people we had on our list that were 75 and older. And we were moving over into our 65 and older and people with 2 existing conditions. This was about 1,100 people, Mark and Tim, that were on those 2 lists. And we made the decision to use a good percentage of them. I'd probably say about 90% of them had provided us with email addresses. And we had sent out emails because as we undertook trying to schedule with some extra doses that we had from the housing authority, we were averaging 9 phone calls to get 1 person into our clinics. People in those groups have been able to get vaccine, are getting vaccine, which was a great problem to have, but it was not very efficient on our part. So Mark and Tim undertook a big email push out to these residents who had asked to be on our communication list. And I can't tell you how many of them responded and were just like, oh my God, you didn't forget me. You didn't, they were very appreciative, even though they were vaccinated a month ago, that somebody hadn't just thrown that list onto a hard drive and left it there. So again, it's very uplifting to us to get those emails with all the hard work we've done and all the times now that we feel like we're banging our heads against the wall, trying to get the state to see the efficiencies and the humanity in the clinics that we're able to run over the large vaccine sites. So I just want to say thank you to everybody who responded with just the positives, as well as the people that were able to come out.
People are usually quick to just vocalize negative, and it's nice when it's positive. And
I'll be honest, the parents have been so appreciative and magnificent in my role as a school nurse. They've been amazing. I mean, they really recognize everything the school nurses are doing. And for the most part, I mean, there's always going to be, people that are unhappy with something or other. But I think one thing the pandemic brought out is a lot of appreciation for what health professionals do, or public health professionals do. Chris, were you going to say something?
No, I think I said enough.
Kristen, may I ask a different question of a different?
Sure.
Hold on. Now my dogs are being ridiculous.
They sound like really big ones, Aria, too.
Oh yeah, they weigh 11 pounds. Yeah, they're great. So with this new travel advisory, if kids are leaving states with two fully vaccinated parents, are they then required to quarantine?
So the state is holding with its interpretation that I believe, and I would have to look and see if it's 10 and under inclusive or if it's under 10 exclusive. I would have to confirm where the actual 10-year-olds fall. I do believe they fall, I think it's 10 and under, are basically do what the parents do. So if a 8-year-old were to leave the state with two vaccinated parents, upon return, that child should be viewed under the state's travel order, is viewed as if they were the parents and would not be required to quarantine.
Did that answer your question, Aria? She's
Yeah,
probably
sorry, I
trying
was
to-
trying to prevent the hysterical dogs from being loud. Yes, thank you, Kristen. That was perfect.
The only reason my dog's not doing it is my husband's holding her little face. So
I'm done.
so we're good. Anybody have anything else? Okay, so I'd like to make a motion to adjourn the meeting at 5:51.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. All right, thanks, everyone.
Thank
Thanks,
you.
guys.
Bye.